Welcome back, everybody. This Week in America on the Blue Funk Broadcasting Radio Network. Great to have you with us on the program today. Our website, of course, thisweekinamerica.us. Information there on our guest on the program. With us, as mentioned, we've got Dr. John Symes, veterinary expert Dr. J, specializing in food intolerance in pets and their people. This will be a fascinating discussion. Dr. Symes, welcome to the program. Great to have you with us.
Yeah, thanks. It's great to be here, Rick.
So many interesting things we want to talk about during the course of the program today. And let's set the table by going back and talking about your particular situation, and then we'll talk about the relationship between that and how you're treating pets. But you were really sick for a while. In fact, your brother was very sick with food intolerance, and then you sort of finally figured it out and put the pieces together.
That's right. Yeah, it's a phenomenal story, really. I can remember the day that my brother walked into my veterinary hospital, and he was having a really horrible last 6 months where he had lost a tremendous amount of weight and had become life-threateningly anemic, which turned out to be the big red flag for celiac disease or food intolerance, is iron deficiency anemia. And the doctors had run every test in the world on him, and they were really talking about opening him up to find the cancer that he didn't have, when out of the blue, a buddy of his who does what I do now, internet medical research, sent him an article on celiac disease, and he brought it into my veterinary hospital and handed it to me, and I started reading it, and boy, the wheels started turning. As I've written many times on my website, it was like somebody finally put the proper program into a computer that was stalled, and everything started running.
Right.
And medicine started making sense for the first time in my life. It really was the life-changing.
Well, it was life-changing, yeah, for your brother and yourself. Yeah. How did this work out for you? Because you went through a number of health issues yourself leading up to this point.
Yeah, I started having, some depression and a lot of allergies and irritable bowel syndrome and heartburn, and insomnia started kicking in, and then that progressed into fibromyalgia. I actually had fibromyalgia for about 2 years. And so by age 45, I was on 2 or 3 prescription drugs at any given moment, and medicating myself, taking cortisone and antihistamines off of my own shelf just to try to get through the days, especially through the cat reactions I was starting to have. I was starting to develop some serious cat allergies, and fortunately, I haven't had one of those in 12 years now since I changed my diet. When I read that email of my brother's that had listed all the things for celiac disease, it pretty much nailed me, and so I went off of wheat right at that moment, and things started changing rapidly. Within the week, I was already feeling better.
Our guest on This Week in America is Dr. John Symes, the veterinary expert Dr. J, over 30 years veterinary experience, developed a diet, and we'll talk about that here in a little bit, that has helped animals all over the world, and a mission now to get this word out to pet owners as well as veterinarians all across the world. Let's go back and talk about that gluten intolerance. What exactly are we talking about? A lot of people, they hear it now, it's been in the news for the last couple of years, don't necessarily understand it, and it's something that I understand really impacts about 1 in 3 people.
That's right. It's actually so much more common than we thought, and actually we're really coming to the conclusion that it's pretty universal among anything that eats wheat, because we're finding that there's more wrong with wheat than just gluten. And so our terminology has kind of changed. At first we were talking about celiac disease, but celiac disease is actually, really look at it as the most serious form of this. So we talk about celiac disease, which is really severe intolerance to gluten and the damage to the lining of the intestinal tract and the bombardment of your internal tissues with gluten that results in inflammation all through the body, from the brain to the big toe. But then we have these people that are not that bad. They feel depressed. They have some intestinal problems, some symptoms, and they're now being called gluten sensitive. There's immunological tests that help to determine these things, and some of which are, have genetic markers. But what we're finding now is that there's more wrong with wheat than just gluten. And one of the things that people can read about now is this new protein, new lectin that they found in wheat called WGA, or wheat germ agglutinin. And this guy, this helps to explain the people that have gone off of wheat, that were negative on all the gluten-related tests, all the immunological tests for gluten. They were negative, but they decided to go off of wheat anyway and felt so much better. And so we're finding that there's more wrong with wheat than just gluten.
If somebody is listening and going, you know what, those symptoms sound like something that I have, and my doctor really hasn't been able to diagnose anything, sort of what your brother was going through.
Right.
What do you recommend for them to do? And then we'll talk about what we do with pets as well. But I mean, Yeah, when you're saying 1 in 3, we're talking about a lot of people that are impacted, and like I said, many maybe don't even know it.
That's right. That's right. The official number of true celiacs in Italy now is 1 in 30 people, and here in the United States, we're talking about numbers like that too. But once we start introducing, the WGA and the other things that we think are more universal, now we're down to the 1 in 3 or these really high numbers. And for those people, the best thing to do is just simply go off of gluten. And I tell people to go off of gluten for 1 week and just see how they feel. And invariably, I get an email back or a phone call back saying, that they felt incredibly better. The emails a lot of times start out OMG, and they feel so much better. But they tell me that it didn't take a week; it only takes about 4 days. And I say, yeah, I just didn't want to put that thought in your head. So the response to a gluten-free diet can be very dramatic in some cases, only kind of held back by those who are intolerant of other things. And the bad news is that there's more than just gluten that people are intolerant of. Dairy, soy, corn, and nightshades are also big players, but gluten is clearly the biggest one right now.
Yeah, you talk about those as the 4 horsemen of medical apocalypse.
Right. Yeah, when I start writing melodramatically, which you tend to do after you've been through the experience that I have over the last 12 years. I mean, I tell people I'm in the miracle business now. They kind of sometimes look at you a little odd, but when you start reading the testimonies on my website, the response of epileptics, people with Crohn's disease, people with MS, dogs with that come in for their last opinion. You know what a last opinion is? Fix him or we're going to put him to sleep.
Yes.
And a month later, they're a completely different animal. I mean, these things, it's really astounding, but in some individuals, you've really got to get everything right. And if somebody is really in really horrible shape, or a pet is, then you really want to take the high road and get rid of all of the major players, which are the gluten grains, wheat, barley, and rye, cow milk products, anything made from cow milk, soy, corn, and then even the nightshades, which are, people don't like to talk about the nightshade family, but these are potatoes, tomatoes, eggplant, and peppers, and some people can have some really serious problems with those.
Dr. John Symes, our guest on the program, veterinarian, his website, he mentioned that, and there's so much information at the website, and I was reviewing it before the program, and a lot of really positive results when people who had just about given up with their pets, and suddenly it's like they have a whole new animal. The website is drogtorj.com, drj.com. You can go to our website, thisweekinamerica.us, and link up to that. When did you make that connection that what's wrong with me and what's wrong with a number of adults might also be similar with their pets?
Well, really, on that first day that I was reading that email with my brother, I looked at the top of the page, and of course it was titled celiac disease, and my brother said, have you ever heard of celiac disease? And I thought for a moment, and just out of the, the gutters of the mind, way back there, all of a sudden I remembered that we were taught about celiac disease in the dog. And the Irish setter. So 34 years ago in veterinary school, I was taught about gluten intolerance in the Irish setter, and that was the only breed that they mentioned. Although there were a few other breeds that were obviously severely food allergic. But so when I started realizing what had happened in the last 20 years, which I did over the next few days after suddenly getting on this bandwagon, suddenly researching it, spending all my extra time researching celiac disease over that next week, the connection started to be made that I went back and read about the gluten intolerance in the Irish setter, and then realized that all of these problems in the dog, the most recent problems, had occurred since we made this major change in dog food about 25 years ago, where we shifted from corn-based to wheat-based dog foods. When I graduated 34 years ago, dog food was corn-based, and it wasn't until the late 80s that we started making dog food out of wheat, and that was because of a lot of factors, geopolitical factors. We had just created this new hybrid wheat that had taken over, and wheat was cheaper than corn now, so they started making dog food out of wheat, and in retrospectively, the health of the dog went down so rapidly it was mind-bending.
And actually, now that that's on the table, you can see that if wheat affects us, the next logical step is it's affecting animals as well.
That's right, and no matter how you approach it, it's logical. I mean, the natural diet of the dog, for example, would be 75% animal origin protein, and then they would eat some fruits and vegetations and some insects and animal poop. They're scavengers by nature, so they eat that kind of thing. They would never eat any of the big 4 horsemen. They never eat any wheat, dairy, soy, or corn. They'd never get nightshades. They wouldn't get these things that unfortunately are the staples in their diet now. The cat cat is even more logical. The cat's almost purely a carnivore, and being one, they have a rather short intestinal tract, which tells you they're not designed to even process these grains. But when you look at the majority of commercial cat foods, you just want to cry, because here we're trying to make a cereal eater out of a carnivore, and no wonder their lives are shortened, and they spend so much time at veterinary hospitals.
Well, all this information, by the way, at drj, DOGTORJ.com. You can link on to our website, thisweekinamerica.us, and link on to get all that information. As we go to the store and we're picking up food for our dogs, cats, what should we be looking for to make sure it is not in the food we're buying?
Well, fortunately, the pet food industry has woken up, I think even before veterinarians have, but veterinarians are now starting to get on the bandwagon, and that is the grain-free diet for the dog and the cat. And so we're kind of in an interesting place in veterinary nutrition right now when one walks into these major pet food shops. That they see these bags that proudly say no wheat, no dairy, no soy, no corn on them now, which is great. I just want to clap when I see them. But then, the bags next to them are loaded with those things. And so it's kind of a minefield out there when you go to a pet shop and buy dog food. But what you're really looking for is these new grain-free diets, which mean basically they're potato-based. And fortunately, a sweet potato and potato-based. And fortunately, dogs generally do very well on white potatoes, even though I mention them in the nightshade family. Most of them do very well, but I'm always on the lookout for those that don't do well. But what you're really looking for is a pet food that the first ingredient is a meat, and then the second ingredients or the third ingredients are going to be potatoes and sweet potatoes, and that they're going to be devoid of the wheat, the barley, the dairy, the soy, and the corn.
Dr. John Symes, our guest on the program, veterinary expert, Dr. J. Website is drj.com, DOGTORJ.com. You talk about, in some cases, table food could be the best food for your pet, and boy, though, that goes against everything we've ever heard. It's like, no, don't feed that to the dog because it'll make the dog sick. Explain why that could be the case.
Where we've thrown the baby out with the bathwater, and again, I kind of hang my head in shame because, I said the same thing for the longest time before I understood all of this. Well, I tell everybody I've been a veterinarian for 34 years, but I've been awake for the last 12, because this was just the awakening, and it catalyzed a lot of extracurricular learning that finally medicine started making sense. But yeah, we've told people for years that table food, but just when you look at this, Rick, 80% of the calories in the American diet come from wheat, dairy, soy, and corn at this point. So we'd almost be better off telling people not to feed their dogs any table food because you got an 80% chance they're going to feed them something wrong. But the other 20% are meat, fruits, and vegetables. And for us to tell our clients not to feed our pets what they would normally eat in nature is pretty crazy, isn't it?
Yes.
So we have thrown the baby out with the bathwater. And also, I mentioned earlier that these dogs are carnivores and cats are strict carnivores, and they're not getting nearly enough protein in their diet. They need more protein, so I encourage my clients to supplement their dog food with meat and eggs and vegetables and fruits. Dogs will eat just about anything. Some dogs will even eat citrus. Cats, my cat will eat, broccoli and carrots and squash and all sorts of vegetables, and I let him do it right off my plate. So we just have to use some common sense here, but the main guidelines, again, avoid the big four, the wheat, the dairy, the soy, and the corn, and give your pet what they would normally eat, which would be meat, fruits, and vegetables.
Got a couple minutes left in the program. In talking about diet, it seems like with what seems to be a very simple diet change, you can really lower the medical expenses for your pet.
Oh, yeah. Yeah, and that's one thing that my colleagues probably don't like to see when that's written in.
I was going to say, and then what's the reaction? Yes.
I am working on a book, and one of the segments of the book, one of the chapters of the book is called Curing Myself Out of Practice. And when I mention that to people in the media or my clients, of course, I always get a good chuckle, but I always say it with a straight face, for a little emphasis, to say, just to emphasize the importance of this. The staples of our veterinary practice, the things that we see day in and day out, are the ear infections, skin infections, vomiting, diarrhea, and these things just disappear when these dogs are on the right diet. These chronic ear problems gone when they're on the right diet. Some inhalant allergies might persist for a while, and so you still get some itchy, scratchy dogs in. But for the most part, they even stop coming in once they're on the hypoallergenic diet long enough. So this is the mother lode. I mean, this is the paradigm shift in both human and veterinary medicine to understand that the staples of our diet are killing us. And if we all go back to a more biological diet, like the paleo diet that's so popular for humans now, miracles are happening, and they're explainable, but it's just amazing.
We've got 30 seconds. I want to talk about, you mentioned before, epilepsy. You actually are able to stop seizures with diet alone.
That's right. That was one of the first discoveries, and we're still one of the most profound. Idiopathic epilepsy, which suggests that we don't know what the cause is. I certainly believe it's viral. Have every reason to believe that. But what's triggering these viruses into causing seizures is the question, and it turns out that the diet is a huge factor. Clearly, the single biggest factor that we have in control, that we have under our control. And I discovered that very early on, after reading about celiac children that were epileptics, when they went gluten-free, their seizures improved dramatically many times, and then I just started pursuing all of the other related things that might be doing that diet-related, and we came up with a diet that's astounding. I mean, it really is. I use that word a lot. I probably overuse that word a lot, but it really is. It's incredible to watch these dogs stop seizing, and the people too.
Yeah, it's hard to come up with new words to describe astounding, and that says it all. And you're right at the forefront on this. Yeah, and it works. You've been there, a pioneer in the study of food intolerance in people and in their pets. The website is drj.com. Doctor is DOGTORJ.com. Dr. John Symes, or John Symes, has been our guest on the program today. And we will have him back because we have much more to talk about, many more questions out there. We've gotten some great information out to the people today. Dr. John Symes, drj.com. Doctor, thank you for joining us. Good luck on the new book. We'll stay in touch on that and have you back on the program.
Thanks. Really enjoyed it, Rick. Appreciate it.
Thank you. You're listening to This Week in America on the Blue Funk Broadcasting Radio Network.